get results more effectively. We're looking into what you can do to cut down on those wait times. But first, concerns that Williamson County residents are contributing to the spread of COVID-19 in schools. Stay with us.
Mueller, Haley Wilgis, and Danielle Breezy's updated weekend forecast. This is News 2 at 10.
Welcome back to News 2 at 10 on this Friday night. Williamson County residents could affect how students learn this fall. The school district is watching how COVID-19 spreads in the community before they make their next move. As News 2's Alex Dennis explains, what happens outside schools will affect what happens inside.
Williamson County School Superintendent Jason Golden believes teachers will welcome students to campus come fall, but with some changes. The district's plan heavily relies on guidance outlined by the Tennessee Commissioner of Health, Dr. Lisa Piercy, and Education Commissioner Penny Schwinn.
One of the items that we really focused on with our health department is the extent to which the virus is in our buildings and the extent to which the WCS community might be contributing to the spread of the virus.
The plan is tethered to real-time transmission rates in the community. Active case counts determine if the county is in low, medium, or high spread. As positive cases increase, so do social distancing requirements within schools.
We were able to establish that those metrics that we've talked about so much for the past month as we've been vetting our plan really triggers a conversation with the local health department when we hit that point.
If cases rise to the medium or high level, Golden will work with health officials to determine if at-home learning must be implemented. To prepare, in the beginning of the school year, students will receive needed resources.
Every student will have a Chromebook assigned to them as the school year starts.
And regardless of the phase, students, teachers, staff, and visitors will receive daily temperature checks and be required to wear a mask.
County Mayor Rogers Anderson issued an order to wear masks when you're in public, and so we want to make it a point to honor that.
In the meantime, Golden urges the community to do their part now to flatten the curve.
We do what we can based on the health guidelines to keep COVID-19 out of our buildings so that we can continue on campus. That's our number one goal.
Alex Dennis, News 2.
And decisions on school reopenings are being finalized across the state. We break those plans down in our half-hour special, COVID-19, Keeping Schools Safe. It airs this Saturday at 6 p.m. here on News 2. The number of people being tested for COVID-19 is on the rise every day, but with labs unable to keep up with the volume, they're looking at how to do it more effectively. Joni Lewis from our sister station explains why you're waiting longer than normal to get your test results back.
The demand is growing.
We do know now that people are accessing testing and that our ability to accommodate requests is becoming a little bit more strained.
Long lines at local testing sites are evidence of that, but there are ways to avoid them.
I think having an appointment does help you go by faster because yesterday my mom went to one, we was there all day, but it's cool. I understand a lot of people have to get tested.
Places like Christ Community Health Services offers pre-registration to expedite testing.
That process really helps us see almost 200 people in two hours.
But they've also been impacted by delayed lab results.
Historically, it was generally 24 to 48 hours. Now, since I would say over the last week or so, we have seen a drastic increase in demand for testing. And so we're looking at 3 to 4 days now.
The health department says for other places, the wait for test results is well over a week.
Quite a bit of efforts going into testing, but we don't have a solution as of today, and yes, it is problematic.
Which is why there's now a focus on ways to test more effectively and prioritizing who's being tested.
We try to get everyone that has any symptoms or have been exposed to actually get testing the same day they call us within reason.
Those currently awaiting test results warn others to do what they can to slow the spread of this virus.
I just want to tell everyone to take it serious, don't downplay it, and wear your mask and keep the social distancing because this is serious.
Here in Nashville, some people are waiting up to 12 days to get test results, something the Tennessee Department of Health Commissioner, Dr. Lisa Piercy, calls, quote, unacceptable. Well, the Laundry Project will